So, when to consult a cardiologist? You may want to see a cardiologist if you're experiencing severe abdominal pain, or you have undigested or unexplained digestive issues, or if there is a suspicion that vascular problems are contributing to your GI symptoms. So, we're going to talk about three tests. Number 27, listening for Bruit sounds. 28, Mesenteric Ischemia testing, and Doppler ultrasound. So let's start with listening for Bruit sounds. This indicates vascular narrowing that may impair intestinal blood flow. So Bruit sounds are abnormal sounds heard through a stethoscope, indicating turbulent blood flow due to narrowing or blockage in venous vessels. So doctor uses a stethoscope to listen to the blood flow sounds in the abdomen. For this, there is no preparation required. That the doctor will simply place a stethoscope on the abdomen to listen for any abnormal sounds. So the presence of Bruit sounds indicate potential vascular narrowing. So obviously, we want a normal sounds, no abnormal sounds detected, and there is non-potential discomfort because it's a non-invasive and is simply a painless procedure. And if a Bruit is detected, for the imaging tests like Doppler ultrasound or mesenteric angiography may be recommended. So now let's move on to number 28, mesenteric ischemia testing. So if you have severe abdominal pain after eating, that may indicate possible blood supply failure to the bowels. So the purpose of this mesenteric ischemia testing is to check for blood supply failure to the bowels, which is causing severe pain and digestive problems. So mesenteric ischemia occurs when a blood flow to the intestines is restricted, and obviously this will lead to pain and potential digestive issues. So this involves various testing such as mesenteric angiography, CT angiography, or Doppler ultrasound. So for this process, fasting may be required before certain imaging test, and depending on the test, you may receive an injection of contrast dye to highlight the blood vessels, and the image will show any blockage or narrowing in the mesenteric arteries. And the normal result is normal blood flow through the mesenteric arteries, and you may have a mild discomfort because from fasting, and if the injection is required from the contrast dye, from that you may get a mild discomfort. Other than that, I think it should be a fairly simple process. uh, so after the test, the treatment options may include angioplasty, stenting, or surgery if mesenteric ischemia is confirmed. The third test which you can request or you can discuss with cardiologist is Doppler ultrasound. And if there is suspicion of mesenteric artery abnormalities or wall thickening affecting bowel function, this is also the advanced way of assessing mesenteric arteries for abnormalities or wall thickening affecting bowel function. So Doppler ultrasound measures the blood flow and can detect abnormalities in the mesenteric arteries. This is how it's conducted. An ultrasound device uses sound waves to visualize the blood flow in the mesenteric arteries. For this, no specific preparation is required. A gel is applied on the abdomen and a handheld device transducer is moved over the area to capture images. The images show blood flow and any abnormalities in the mesenteric arteries. And obviously, normal result is normal blood flow with no abnormalities or wall thickening. Essentially, it is very minimal discomfort from the pressure of the transducer on the abdomen or some cold sensation because of the gel. So if the abnormalities are found for the test, like angioplasty or surgery may be recommended. So these three tests from the cardiologist can also explain the blood flow in the abdominal area and confirm that that is not causing the gastrointestinal distress. And obviously, if all the tests are done and the diagnosis is not possible to rule out the vascular problems, is important to see the cardiologist, and you can discuss that with your gastroenterologist.